Hi everyone, this is Shihab from DFIT. I'm a personal trainer in Dubai. Today I would like to talk about PCOS and PCOD. There are a lot of questions related on this topic. So I would like to share some of my knowledge based on my experience and research. It might be useful for the trainers who are dealing with this type of clients or the females who are having those kind of issues. Let's look at what is PCOS and what is PCOD. Polycystic Ovarian Syndrome and Polycystic Ovarian Disease both are nearly the same. Polycystic Ovarian Syndrome, it is a set of symptoms coming together and taking place due to an elevated androgen level or male hormone levels in the female body. That means PCOS has PCOD and set of other symptoms as well, like high blood pressure, irregular menstruation, obesity, facial hair growth, infertility. But it doesn't mean all of the symptoms will be present or diagnosed with PCOS patient. Alright, there is 5 points that you need to know before you're dealing with any PCOS clients. Number 1, hormone. This is a common hormone disorder among female individuals during their reproductive age. Number 2, ovaries. Ovaries produces higher level of androgen than usual. This will interfere the development and release of the eggs inside the ovaries. Some of the eggs develop into unruptured follicles. These unruptured follicles are little sacs filled with liquid. And the actual size of these follicles like 2 to 3 centimeters. Number 3, no cause. There is no scientific evidence behind this reason. But it might be related to the genetic, environmental factors or obesity. Number 4, no cure. There is no 100% cure for this, but you can prevent as long as you follow a proper diet, exercise and nutritional programs. This will also control obesity, body weight and insulin resistance. Number 5 is a message. 1 in every 10 female individuals have this medical condition, so there is nothing wrong with that. The more important, find the symptoms at the earliest as possible in order to control the infertility. Let's talk about what are the medical conditions associated with this PCOS. 50 to 80% females with PCOS are overweight or obese. There is high risk for diabetes too. Glucose intolerance and insulin resistance. Dyslipidemia. It means a high level of cholesterol or triglycerides inside the bloodstream. Obstructive sleep apnea. Non-alcoholic fatty liver. Depression and anxiety. Let's look at what is the best exercise for PCOS. There is no restriction with any type of exercises. They can do pretty much everything. But the training intensity, frequency, time, duration can be designed based on their comorbidities. So let's look at nutrition. Diet and nutrition plays an important role in PCOS. The most important thing, first one, no added sugar. If you are buying any food items, make sure that there is no added sugar more than 5 grams per servings. But fruits are the natural source of sugars and vitamins. It can be used in moderation. There are certain fruits items like apple, pear, peach, plum, berries are low in glycemic and rich in antioxidants. Number 2, fat. Limit your intake of saturated and trans fat from the diet. Instead of these fat, choose smaller amount of unsaturated fat from the food items like nuts, olive oil and avocados. Number 3, carbohydrates. Carbohydrates are the good source of energy. The first thing in carbohydrates, avoid white flour from the food. At the same time, also the bakery items and pastries, then carbonated drinks. The healthy carbohydrates are rich in fiber. You can use healthy carbohydrates like oatmeal, brown rice, quinoa, wheat bran, and buckwheat, many other carbohydrates are available in the market. However, there is no specific exercise or diet or nutritional plan to prevent or treat this PCOS. It is all about lifestyle changes. Being active and eating healthy will help you to manage the long-term health complications. Also, it helps you to lower the risk of diabetes and heart disease. Thanks for watching this video. Please comment below if you have any suggestions. Stay safe and stay healthy. Good day.